Hello, it's Dr. Pat with Little Critters, and we have Turbo here, a beautiful 15-year-old Sulcata Tortoise. They're also called African spurred, and she is in today because she was outside brunating, and the owners noticed that she would come out more often than usual. She would lay her head down, hang her arms out, was just very lethargic and very weak. And if you look at her, you can see that she keeps closing her eyes and has eye discharge bilaterally. She also has nose discharge or nasal discharge, and she sounds very stuffy when you listen to her. This is actually food on the side here. She is still eating and was eating a pepper. Her body condition overall is good. If you look at the top of her head, she has decent fat pads right here still on the top. She is pretty weak, so we can pretty easily hold her leg, where normally they can pull these in and kind of arm her up, where they pull their legs up and tuck their head back and you can't get them out. This is a pretty weak girl. She was a rescue tortoise and she had had an injury at some point in her life. They don't know what it was from, but you can see a compression injury here at the carapace, which is not active, not a problem now. She also did something that many sulcatas do. She started digging and undermining the foundation of the house. And if you look, she has some injuries on the side of the carapace here where she hit the concrete and just kept digging. And I've seen that very frequently in these big tortoises. They'll get stuck in something, they'll get up against cement, and they just keep going because they are turbos for sure. This is a common problem that we see this time of year. So oftentimes these tortoises have either a tortoise herpes virus or a mycoplasma. They can have other infections as well, but those are common ones. And then they are outside and they get chilled, and that lowers their immune system and allows this to flare up. And so they often come in looking very much like her. We're getting some labs on her. We already got a blood draw. So we're gonna check her CBC, so red and white blood cells, and her chemistry, which is her organ panel. You can also actually run tests for herpes and mycoplasma. And we'll start treatment today for the respiratory infection in the eyes. And then we are getting an x-ray of her as well, and so we'll have that today. And lots of supportive care. So she's brought her inside, she's put her under UV light and a heat lamp, so we're warming her up. That's actually what got her eating again. And just to point out really quick, she is a female. So if you look at the front here, these spurs are actually shorter in females. And if you look at the carapace, which is not easy to do, she's about 40 pounds. The plastron, sorry. When you look at the bottom, it's flat. So the males will have a cup at the back and the females have a nice flat level plastron or bottom shell. So that's Turbo, and we're gonna get her cared for because she is a darling and she deserves all the best care.